My name is Vivian Omeda, but I prefer Teddy. My culture background is Ojibwe and Dakota.
Well, my name is William Bill Tanner. I'm Ojibwe from Leech Lake Reservation.
My name is Diana Goodkill, and I'm a Lakota.
My name is Rolanda LaRock. I am Native American from the Ojibwe Nation.
I think my health in general right now is kind of keeping at a level, steady pace, but it could be a lot better. I could eat a lot better.
I think it could be improved. My mother recently passed, so went into depression.
My health is semi-okay at the moment.
I'm not as healthy as I'd like to be because I have diabetes, and I know I need to lose some weight.
One of our most important cultural pastimes is the powwow. So happens every summer, all summer long.
And I know that we have a lot of medicine that we can get from the land and stuff. And one of the main things that we use is like sage tea or swamp tea. And when my grandkids were really sick, when they had the cold and stuff, that swamp tea really helped them to clear up their chest and stuff.
I like to rice a lot and do hunting and balsam picking. I know that's good exercise and stuff like that. But I'm down here in Minneapolis, and you do that, can only do that way up there, up north in the res where the woods are.
My family doesn't quite have any benefits to our culture very much. My mom kind of pushes our culture away, but I'm trying my best to kind of like stay connected. My health in general, how we keep that in check is probably check in with the doctor like maybe 3 or 4 times every year with the doctor, just to like check in and see what's going on.
If I could have like the lady that I know that works at the resource center, she's like a spiritual advisor, and she's really knowledgeable about our cultural medicine and stuff, to bring her in sometime and integrate like both to work together.
Be more informative about local resources in my neighborhood. My clinic's over south side, Minneapolis, and I live over north, and there's hardly anything that they could, extra resources to do to better our health over here.
What I think they should pay more attention to is more so mental health and how that contributes to like physical health in general. I have asthma, and they kind of don't see that very much as a problem. Now that as I'm getting older, they see it as like it should be getting like really better, but it hasn't been. So it's like I just feel like they should keep an eye on that a little bit more and like give people more of an option to see what they can do to like keep that in check.
Well, I suppose I could answer his questions more thoroughly, and then I suppose I could ask more questions too to get the right answers I need for my health.
I feel like they should be more considerate and give people more options. People in general, even if like they have more money than others or less, I feel like people should be treated equally no matter the expense.
I don't like it. Other than that, it treated me all right, other than getting kicked off and terminated.
I really don't like it because I have Medica for secondary and Medicare's primary, and you have to go to one clinic. Like I go to the Indian Health Board, but if I need to see a specialist or something, then I have to go almost all over town to see them, and it's hard when you don't have transportation.
I see that we have one of the best healthcare systems in the whole United States.